Hey, everybody. I want to welcome everybody. We're in Coleman, Alabama for everybody that's online, and we're here to do our third annual MS Symposium here at Coleman. All right, my name is Stuart Schlossman. I'm president and founder of MS Views and News. I too have MS. You all know the story already. Today's program, I would like to thank Sandoz and Novartis for sponsoring us to do this event today, and I hope that you all can give them a round of applause and say thank you as well. All right, and this is Alicia Hamman. She actually is probably well known to some of you all. She lives in the area. Alicia has been a certified nurse practitioner since 2016. She owns her own family practice Indicator. Her heart has always been to treat the whole body, the mind, body, and spirit. Her goal is to help others and has worked as an oncology nurse, emergency room nurse, home health, ENT, and in disaster medical assistance with the government. She sees her practice as a ministry, and let's welcome Alicia. She'll be speaking with you a short while. Come on up.
So yes, as he said, my name's Alicia Hamman, nurse practitioner, and I own my own practice in Decatur, Alabama. So I want to talk to you about this alternative therapy. We're going to talk about different kinds of MS pain. We're going to talk about emotional element of pain. And then we're also going to talk about the alternative therapy with MS pain, the science behind it, and also the benefits of this new treatment. With MS pain, and this is not just with MS, this is also with just general, right? We have musculoskeletal pain. Musculoskeletal pain can be dealing with just your muscle spasms, right? It can be dealing with spasticity, the cramps. It can be dealing with back pain, joint pain. It can be dealing with fatigue and even unexplained pain. Not to mention the neuropathy pain, right? The burning, the tingling, the numbness, right? The sharp and dull pain that just seems to come out of nowhere. And the whole thing about pain is you can't see pain. And it's hard to explain to people what pain really is. It's hard to explain to your family about, this ache that happens because they can't really see it. And that makes it difficult. Going to the next slide. Let's talk about the emotional aspects of pain. So, a lot of times it can just make you angry because, you don't know how is this going to affect your day, right? You don't know how it's going to affect your family, or like some of you talked about, you're single. How does it affect your relationships? It's hard. Not to even, make even little about distress. That it can cause distress in your life. It can cause distress even in your family, in your job. What about exhaustion? Oh, wow. Pain can just make you tired. You're just getting up, just moving, doing your regular, just ADLs, right? Your daily activities, which causes fear. What if I want to go out there and enjoy a family event, kind of like earlier, the heat of the day. I want to go in and I want to spend time with my family. I don't want to be stuck at home. I want to be able to go in and have fun. So that fear comes in, well, what if I go out and I'm only able to go maybe a half a day, and how am I going to get back? How am I going to go from point A to point B? And this doesn't just affect MS. Pain is an issue with people in all dynamics. It really is. And it can alterate the moods, right? I mean, it can make you irritable, can make you snappy, and it can also bring in depression, which is a real thing. Struggling, right? You know, we think about big things, you know, struggling just to go somewhere, but what about just struggling to get up in the morning to brush your hair? What about struggling to get up and just bathe yourself? What about the struggle of not knowing? Are you going to be able to stand up and even fix yourself a meal that day? What if I told you that there was an alternative therapy out there that could help with this? Maybe not with everything, but it could definitely help with relieving pain, and it doesn't have any kind of medications involved in it. What if there's no needle sticks? What if it can decrease inflammation, it can decrease pain, and decrease spasticity? What if I told you that there's a treatment out there that could possibly reduce muscle fibrosis, scar tissue, increase range of motion? That this treatment itself, what it does is it comes in and it increases the blood flow by 50%. And when it does that, it brings your cells to the affected, damaged, and injured areas to regenerate. Sounds too good, doesn't it? It really does, I know. But this alternative therapy is called shockwave therapy. So it was in 2015, there was a study in Italy, and in the study it took MS patients with spasticity and pain, and it actually helped. It helped reduce the pain, and it helped reduce the spasticity. So in saying this, let me tell you a little bit about what it is, and then I want to get into a story, because I like stories. I don't know about you. I hate reading off a PowerPoint. So it is hydroacoustic sound waves, which sounds like a big whole lot of stuff. But what it does, it goes in and stimulates the tissue. When it does that, it comes in and brings the stem cells, like I said earlier, and brings a healing. So let me tell you how I found out about this. I had, like I said earlier, I'm a primary care provider. I had a patient come into my office, and they said they knew somebody that had a rotator cuff tear. They went to Atlanta, they had some treatments. 6 weeks later, they were back in the gym lifting weights. I said, really? I don't believe that. So I started researching about this machine, researching about the technology. It took me about 3 months to make the decision. Well, when I did, I integrated it into my office and started seeing success with it. Excited, because if something's so good, why do you want to keep it quiet, right? Well, I had a patient come in, and they came in their electric wheelchair. They came in and they kind of flipped around, and they said, you know, I've spent a lot of money on a lot of different treatments. I bought a lot of stuff off TV. I bought a lot of different supplements. I have MS. Do you think this could help me? Well, to be honest, my whole thought was, you know, I don't know. They say that it possibly can, but I can't guarantee anything. And she's like, well, I'm willing to try. She said, I have been in a wheelchair for 14 to 15 years. I have not been able to raise her hand, spasticity in her hand. She'd have to pull it up like this, and it'd go back down. Pull it up, and it'd go back down. She said, I hadn't been able to feel my bladder to know when I have to urinate. I'm exhausted. I can't roll myself over in bed. I have so many people, family support, but they have to help me with so many different things. So we started a few treatments, and I'm like flabbergasted. She was able to, after several treatments, to lift her left leg up about 5 inches off the step of the wheelchair. Now she can lift her right up, off and on. Her hand, that was spastic. I'm sorry, you guys, this is just exciting to me, when you see stuff. Her hand that is like this, right? She has full mobility now. Where she helps her husband with doing rental property, she can write the checks now, where before she couldn't write the checks. She can feel how full her bladder is to know whether she needs to use the restroom or not. Although she says that that's very irritating. I guess you take the good and the bad, right? So, that's just a few things. She's able to roll herself over in bed a little bit more than what she was before. Is she walking? Not necessarily. But at this point, these things have made a difference in her life. So let me tell you about patient number 2. Patient number 2 came in. She came in on a motorized scooter. I'm just going to tell you, God doesn't give me easy things, okay? I'm just going to say. Comes in on a motorized scooter. She goes all the way back towards the back of my office, and she gets off of her scooter, which took about 3 minutes for her to do this because her leg spasmed. I don't know if y'all know what spasms are, but they spasm. You almost have to wait maybe 5 minutes or so for the leg to come down, or somebody to come in and push it in to where she could get off the scooter to get on the walker to go to the restroom. She came back from the restroom, had to sit down for about 5 minutes before she could even go into the treatment room. She got in the treatment room. We had the same conversation. Do you think this could help me? I've got pain. I've got lymphedema. I've got these sores on my legs. I've been dealing with this and haven't really even been able to go on any kind of family vacations or anything for probably about 3 years. Once again, I'm like, we can try. So that's what we did. We tried. Now, I'm excited to say that she's able to come into the office, and she can, from her vehicle, she comes in with the walker. She keeps the scooter in case she gets tired, because I think it's Karen to talk about the spoonfuls of energy. You don't always know how much energy you're going to have that day. But she'll come in, and when she would scoot like this before, she's actually lifting her heels up now. Able to walks all the way back on the walker, all the way to the bathroom. She comes from the Jones Valley area, so she comes over an hour for treatments. She leaves there and walks straight into the treatment room. She doesn't have to take any rest. What she tells me is that it has increased her energy. It has helped her with her leg wounds, which I'm still trying to understand that. I mean, I think it's phenomenal, but I'm like, okay. And she also says that just the energy and the there's another word for energy that she says, but she's able to kind of go through. She just has more momentum throughout the whole day. So she has gone from not really being able to do a whole lot, right, she went to, let me get this right in order, Atlanta with her daughter on a trip, and she was able to enjoy the whole trip. She went to Florida for about a month, and then last week before, she just went to Nashville. Is she still on with the walker and the scooter? She is, but she says she just feels better. So let me tell you about patient number 3. This patient just says that she has hope. She's newly diagnosed with MS. And when she came into the office, she was just very angry, very frustrated, depressed, tearful. She had spasms from her neck going down to her shoulders, and so much pain it was hard for her to wear a bra or even wear a shirt because it just hurt. Very uncomfortable. We started treatments, and now she can wear her bra and her shirt, and it doesn't feel as bad. The numb and tingling in her hands has decreased some. But she said the biggest thing that she has is not just a pain relief, but the biggest thing that she has is she just feels better. Just an emotional fact that there's a little bit of hope to something. It's not a cure, but something to help with and help treat the symptoms. So it's been very interesting to me how this has worked, and that's really why I'm here, you guys, is, I've got 3 patients, 4 total. The other one's doing good, but she's in and out, not consistent like these 3. And when I see a difference consecutive, and they're telling me, you got to tell people about this, that's one of the reasons I'm here. So in conclusion about the shockwave therapy, it's a non-invasive, so there's no needles, there's no, once again, no medications involved. And it helps to target areas of inflammation, target areas of diseased and damaged tissue. It helps to migrate the cells to bring regeneration to those damaged areas. It can help decrease spasticity. It can help decrease pain, and it definitely decreases inflammation. Increase the range of motion. So that's really, you guys, really why I'm here, is just to kind of let you know that there is something out there available that could possibly help in different areas. And if you guys have any questions, I think, is that okay, Stuart?
That is fine. Thank you very much. Thank you for speaking today.
Does the machine do like a massage or a heat, or can you discuss a little bit about what the sensation is that we will feel?
Yes, ma'am, I can. It's more like an ultrasound. The sound waves penetrate. If you don't have any kind of damaged or diseased tissue, it just feels like it glides over the skin. If it finds something that's diseased or damaged or inflamed, it kind of feels like a little bit of a hammer on a chisel, a little bit. It lets you know that triggered area to help us know that's the area we need to treat. But there's no light therapy involved in it, like the red light therapy that you're probably thinking about. It's not like that. It's literally sound waves. To be honest with you, it's like a spark plug in a fluid that sends out a spark, and those sound waves go 3,500 miles an hour, about this deep into the tissue.
Thank you.
Okay, will our insurance?
No, ma'am, it's cash pay.
Okay.
That's the sad part about it right now.
By the way, we normally don't pitch a product, and we're not pitching a product here today. Dr.
we're not.
Legank said that this would be a great item, though, for people to know about, which is why I asked Alicia to speak at this program. Okay?
Right.
Okay,
So this is the ultrasound, and it makes heat it brings heat to a certain area. So you're saying that it brings like the mesenchymal stem cells to that area to regenerate. My question is, I was going to do this, but I had a hip replacement. They wouldn't touch it. They will go nowhere near a hip replacement because it does damage to the soft tissue. So how would you get around that area? Because I have a lot of leg pain. So nobody told me when I got the hip replacement that,
Yeah. Yeah, I'd be glad to answer that. Honestly, it is approved to go over any kind of hip replacements or anything like that. You can, because this doesn't damage the tissue. It expands the cells and contracts, but it doesn't damage them at all. You cannot do it over a pacemaker. You can't do it over a uterus with a fetus, but you can do it over a hip replacement.
Next question's over here.
How long-term are the effects from this? Because you're not actually repairing our damaged myelin, correct?
Well, that's an interesting question. So let me tell you a little experiment I did. I'm kind of like that. I kind of think off the cuff a little bit, you guys. I wanted to know what it would do on an egg. So I did the treatment on an egg because I was like, is it going to bust? So I was holding it down in the garbage, doing the treatment like this, ready for it to explode. And it didn't. But what it did do, it created a membrane around the yolk, which I thought was very interesting. Is that why this is helping with MS? Is because it's helping repair the myelin sheath? I don't know positively. But it's a possibility. Because of taking care of the inflammation and stuff. I don't know if that answered your question or not.
Okay, another one from the center of the room. I'll be there in a moment.
When you said repair, are we talking about, when you said rotator cuff surgery, rotator cuffs, are we talking about regenerating a tendon tear?
Yeah, and I guess this was kind of the other question she had. It can repair up to a 1/2-inch rotator cuff tear. It can't repair a whole tear. It can't. So what it does is if you have a rotator cuff tear and you have surgery, you're going to be in a demobilizer. You're going to be out of work for about 6 to 8 weeks or months, really. Then you have to go through physical therapy. With this, you're actually able to continue to work. It will take, because of it being a tear, it does take time for the repair to go on. But I did have somebody that had a tear here, and we had MRI before, and I guess about 16 treatments afterwards, it was healed and repaired.
I have a question. What's the percentage of those that come in for a treatment? What is the percentage of actually you finding that there is a repair done?
Finding what? I'm sorry.
What's the percentage of the people that are treated are actually fixed?
That are actually fixed? I would say in my office right now, and this is going across the board with anything with, the MS, which I wouldn't say fixed, but I'm going to say supportive, right, to the rotator knees and stuff like that. We're looking at about 85 to 90% success.
I'd like to know the price of a visit and how many times you actually have to go to really see a difference with MS.
They recommend at least 10 treatments is what they recommend. If it is a chronic issue or an inflamed, like arthritis or things like that, it may be a monthly. I'd probably just say just stop by the booth and ask that.
Okay, I was going to ask that too.
Great.
Can I answer
right.
that? Is that
Sure.
okay if I answer that? Okay. I wasn't for sure. The price varies from different different offices and stuff. Ours initially is like $200 for the official fee, and then $97 per treatment after that. It is expensive.
All
I
right.
know.
Thank you very much. Let's thank Alicia for coming down and speaking with us today.
Thank you.
All right, so we're wrapping this up. Again, thank you everybody for coming. We cannot do these programs without you. And so thank you. Thank you.